Just a stone's throw from here is the House of Commons, where Jeremy Hunt, the Chancellor, is on his feet delivering the budget. But what exactly do some floating voters on board this barge, which is also a pub, make of what Mr Hunt had to say?
Mr Chancellor of the Exchequer.
The way we tax people's income is particularly unfair. Today, because of the progress we have made bringing down inflation, because of the additional investment that is flowing into the economy, because we have asked those with the broadest shoulders to pay a bit more, today I go further. From April the 6th, employee national insurance will be cut by another 2p from 10% to 8%.
So I'm Dennis Reed, I'm Director of Silver Voices, which is a campaign group for the over 60s, and for my sins I'm 75 years old.
Now, if the Chancellor had cut income tax, that would have benefited a huge number of pensioners. He's opted not to do that. I wondered if you were frustrated that the personal tax cut, again, is not going to benefit pensioners.
Pensioners do not pay national insurance, so we get no benefit whatsoever from this change in national insurance. We didn't get anything from the autumn statement when he also reduced national insurance, and it seems like the whole thing is about younger people, working families. That's great, but what about older people? We were completely ignored as far as the budget was concerned.
The NHS is rightly the biggest reason most of us are proud to be British. We will slash the 13 million hours lost by doctors and nurses every year to outdated IT systems. We will cut down and potentially halve form filling by doctors using AI.
Hi, my name is Grace Conti. I'm a general practice nurse and I'm 34 years old.
I mean, there was a lot in there on efficiency, saying that the NHS should be more efficient. Essentially, you and your colleagues are going to have government input in terms of being more efficient. Is that something you recognise? Is that a good idea?
I don't know how much more efficient my nursing and doctor and allied health professionals can be. I think the age of using AI and technology is essential to the survival of any health service, most likely, and especially so the NHS. Now, one of the things they left out and didn't even utter the word was social care. The NHS, I suppose, can't sustain its level of productivity if social care is lagging behind. If we can't discharge patients, I can work as fast as I can to get them ready to go home, but if there's nowhere for them to go, then here we are stuck in the same situation.
The way we treat child benefit in the tax system is confusing and unfair. It's a lifeline for many parents. I confirm that from this April, the high-income child benefit charge threshold will be raised from £50,000 to £60,000.
I'm Connor Wilson, I'm 32 and I served for 8 years as a British Army officer.
Now, you're a father of two, 7-year-old and a 3-year-old. What did you make of what you heard from the Chancellor on that?
I liked the upping of the threshold of the child benefit. It's something I'm sort of on the cusp of. And the Chancellor spoke about the unfairness about people, about the sort of household income as a total not being taken into consideration. That has been a frustration of mine for many years, and I did like the fact that that was getting addressed.
Our armed forces remain the most professional and best funded in Europe. With defence spending already more than 2% of GDP, we're providing more military support to Ukraine than nearly any other country, and our spending will rise to 2.5% as soon as economic conditions allow.
I think defence expected nothing and they got nothing.
Growth up, jobs up, taxes down. I commend this statement to the House.
Listening to what Jeremy Hunt says, the sort of crux moment, are you more likely to vote Conservative as a result?
No.
And why not?
800,000 older people who are brought into the tax system for the first time in April. What incentive is there for them to vote Conservative? What incentive was there? I didn't see it.
No, absolutely not. I think he was appealing to a very small niche demographic of sort of Tory voters that are looking for things like tax cuts to stop them sort of being annihilated at the next election.
Not at all. I think we're ready for a shake-up in the government, definitely, and I'd be interested to see what a Labour leadership could do for Britain, for the NHS, for healthcare workers and for myself.
it's fair to say from their answers they're not totally won over. The Chancellor mentioned that the UK was second only to Hollywood. The Tories are going to have to put on one hell of a performance if they're to win that general election.